It's National Chiropractic Month, and today we're going to investigate and look into what chiropractic is, who it's for, and I think the research and the benefits are going to surprise you. Welcome to the Enhance Your Health podcast. I'm your host, Dr. Michelle Green, and you can join us each week where you will learn practical ways to enhance your overall health, physical and mental, along with special guest episodes from experts around the world. New episodes out each week on Mondays at 5 p.m. Pacific Standard Time for tips and action steps so that you can become the master of your health and life. And remember, this podcast is for educational and informational purposes only. You should always check with a healthcare professional before trying any new health protocol. It's time to enhance your health. Hey everybody, it's Dr. Michelle Green here. Welcome to the Enhance Your Health podcast. So excited. This is our 10th episode and we are going to talk about chiropractic today. This week's quote is by BJ Palmer, the developer of chiropractic, and the quote reads, "So what chiropractic does is that it simply takes the handcuffs off nature, as it were, by finding the particular vertebra that had shifted and restoring it to its natural position. The adjustment thus releases the natural flow of nerve impulse. When the maze of nerves, or nature's communication system, supplies the body with the energy it needs for well-being, you have health." And that is a great quote by BJ Palmer, the developer of chiropractic. And that really is what chiropractic is. It's removing interference from the nerve system, allowing the body to heal and work at 100% capacity. So what is chiropractic? Chiropractic is a hands-on, conservative approach to care, mainly focusing on removing subluxations from the spine to allow the nervous system to work the way it's supposed to. The reason that the main area of focus is the spine is because the spine houses the nervous system. So what happens is you have your brain, and your skull is surrounding your brain, protecting your brain. And then from your brain stem, then you have a spinal cord going all the way down your spine. And your vertebrae are actually protecting your spinal cord. So the brain stem that's coming off the brain that turns into the spinal cord sits right at the first vertebra, C1. And then at every single level of your spine, nerves are coming off on each side. And those nerves go to your organs, your glands, everything that makes your body move, your body work, your organs work. Every single cell can be traced back to a nerve. In fact, every cell has 4 to 6 nerve fibers going to it, controlling it, telling it what to do, and making sure that everything is running smoothly. Now, when your body is under stress, what happens is that it will actually put your nervous system into a stress state, and it can lead to what is known by chiropractors as subluxation, which means that the nerve signal isn't able to work or communicate 100%. The nervous system is the communication network of the body. And so if for some reason that is dimmed, it's almost like a light switch. If you dim that light switch to 50%, you're not going to get the same amount of light coming out of that light bulb. And that's the idea with subluxation, is if there's something going on with your spine called a subluxation, it can dim the signal coming out from those nerves. Think about it like a cell phone. When you're talking on the phone and you're communicating with someone, if you have full bars, you can communicate just fine and hear every single word the person is telling you. But if you are communicating and you have 0 bars or even 1 bar, you might only hear every other word that the other person on the other line is saying. And so what percentage do you want your brain and your nervous system to work? You want full bars, right? Full communication. And that really is what it's doing, is it's your communication system. We want that working at 100% so that your body can heal 100% and work the way it's supposed to. Now, I said stress is the cause of subluxation. Now, what do I mean by stress? Stress comes from 3 different main categories. Stress, like emotional stress, definitely. That can put our body into a fight or flight mode, affecting our nervous system, affecting our posture, all of these things. And then, of course, there is stress, chemical stress, stress coming from eating a bunch of sugar or eating bad food or cigarettes or alcohol. These things can put our body into a stressed state. And then the third thing is physical trauma. So it's thoughts, toxins, and then trauma. And what do I mean by trauma? Definitely if you're in a big car accident, that can definitely affect your spine and your nervous system and change the way your body is sending and receiving signals. But also micro trauma. So let's say you are constantly looking down at your phone. If you're constantly looking down on your phone, that is putting strain on your neck. And you do that every single day for hours and hours and hours. Eventually, and I've seen it on x-rays, eventually that is going to have a change in your nervous system and in your spine. Since your spine houses your nervous system, they're very closely related. Now, the Australian Spinal Research Foundation, they recently came up with a definition for subluxation to help others understand what subluxation is. They do a lot of research on subluxation and chiropractic and how it can help people. And the definition that they came up with is this: a vertebral subluxation is a diminished state of being, comprising of a state of reduced coherence, altered biomechanical function, altered neurological function, and altered adaptability. There are over 200 different types of chiropractic care. When I say chiropractic care, the majority of you probably think of the type of chiropractic care that's most common, which is great, and that's known as diversified type of chiropractic care. That type of care, usually there's a sound when your spine is adjusted called a cavitation, and it is the most well-known type of care. However, I did just mention there are over 200 types of chiropractic care. So there are different types ranging from upper cervical care. Upper cervical care only focuses on the upper cervical vertebra. Remember I said the brainstem sits right there, and so they adjust and look at that upper cervical vertebra. There's also network spinal, which is another type of chiropractic care that uses very light touches on very specific points in the spine. And there are so many other types as well. Finding the right chiropractor is kind of like finding the right hairdresser, except the stakes are much higher because your health is involved. But when you go to a hairdresser, you might try a new hairdresser and it might not be the right cut for you, or you don't like something that hairdresser did or their technique that they used. So you're going to go to another hairdresser and try a new one that might have a different technique and might work better for your hair, and you're going to find one that makes you happy. So it's the same thing with chiropractic. There are over 200 types of chiropractic techniques, and one might not work great for you, but one might work really well for you. So it's really good to do your research and figure out what does your body like. For instance, my dad goes to a chiropractor and my mom goes to a completely different type of chiropractor because they work differently for their bodies. So find one that works for you, find one that is really focusing on the nervous system, removing those subluxations and helping you to be the best you can be. Who is chiropractic good for? Chiropractic is great for anyone with a spine. Chiropractic is great for anyone with a spine, whether you're an hour old or you're a senior in your 80s or 90s, even 100 years old. Chiropractic care can be very beneficial for you. And there are studies that show that even if you aren't having neck pain or back pain or any type of symptoms, you're just going there for wellness. There was a review of literature that took all the studies and showed that people, even if they didn't have any symptoms, still receive benefits. They received benefits like increased visual acuity. Women who were pregnant, it's safe for pregnant moms. Women who were pregnant had a decreased labor time. There was changes in reaction time and information processing. autonomic function, endocrine function, immune function, and heart rate variability. There were changes in the heart rate variability score as well, which, if you remember from the episode about the vagus nerve, that is the golden standard for looking at how your nervous system is functioning, specifically your vagus nerve. There were also changes such as range of motion and respiration, the breathing capacity, and these are all people that came in with no symptoms at all, but their quality of life and changes in their body improved in ways they didn't even think they needed. So even if you don't have symptoms, it's a great thing to come and get your spine at least checked. Chiropractors don't treat anything. They just remove the interference in the spine and let the body do the rest, let the body do the healing. Now, a chiropractor is a doctor of chiropractic, and the level of education they get is a 4-year degree, and they go through anatomy, physiology, biochemistry, all of the sciences and understanding of the body. They understand nutrition, and they take classes in biomechanics and imaging and all of these things. So it is a doctorate level of education and understanding of the body, and they go through 4 years of understanding how the body works, as well as technique in chiropractic technique as well. Of course, there's a lot of research and credibility in chiropractic, working really great for things like neck pain and back pain and headaches and things like that. Definitely a profession being looked at within this opioid crisis that our country is going through, because chiropractic offers a drug-free solution to the pain, and it's a conservative treatment, and it prevents a lot of people from having to go on painkillers because they're able to get that pain relief from this hands-on drug-free chiropractic care. Chiropractic can offer so much, and it's amazing what happens when you unlock the body's potential to be able to heal the way that it's supposed to. Now, I started going to a chiropractor since I was a baby. My mom took me to a chiropractor because I was colic and I wouldn't stop crying. I couldn't take food down. And she took me to a chiropractor and got me adjusted, and I was not even 1 year old. And it actually helped my body be able to function the way it was supposed to, and I actually didn't have colic anymore. And that was my first experience with chiropractic, my mom taking me when I was a baby. And that's the cool thing about chiropractic, is that it's safe and great for any age. So to my relief and my mom's relief, I actually stopped having these episodes and I wasn't colic anymore. My mom actually started going to a chiropractor in the 60s when she was just a little girl. She had a very stressful and hard birth. She actually was taken out of my grandmother with one of those vacuum suctioners that pulled my mom out by the head. So as a little girl, she always got migraines and headaches really bad. At 5 years old, she would spend days in her bed because she had migraines. And her brother had chronic ear infections, and her other brother had chronic asthma and reoccurring pneumonia. So my grandma had 3 kids, all under the age of 5, and she didn't know what to do. She kept taking them to doctors and putting them on different medications, antibiotics, and nothing would provide a long-term solution. So against my grandpa's will, my grandma took her 3 kids to the chiropractor, and it was an upper cervical chiropractor actually. And within a couple of months, all of their symptoms went away. My mom stopped getting headaches and migraines. She was able to be a kid the way she was supposed to be when you're 5 years old, playing and not stuck in your bed. Her brothers didn't get ear infections anymore, or pneumonia and asthma. All of these things went away, and all the chiropractor did was his adjustment, realigning the spine, which has an effect on the overall body. So my mom grew up going to a chiropractor, and so when I was sick, that's why she took me to a chiropractor. As a teenager, I stopped going to a chiropractor. I was super busy. I was in cheer, and I was in different clubs and in high school, But I started getting headaches every single day. I was getting headaches all the time. I was in cheers, so there was a lot of falling. I was a bass. People would fall on my head, and there's a lot of physical trauma going on in my spine. So my mom set me up for an appointment, and I started going to the chiropractor again, and I felt so much better. Chiropractic is meant to help your body be able to be at its full potential and to heal. In my years as a chiropractor, I've seen some pretty amazing things when you free up the body to be able to do the things that it's supposed to do, heal and function properly and function at 100%. In fact, while I was in chiropractic school, someone very close to me, he actually was suffering with really severe anxiety. Overall anxiety, but also panic disorder, OCD, and agoraphobia, not even able to leave his house at times without taking medication, and became reliant on this medication that he couldn't even leave his house without. And he really wanted to get off of the medication and be able to function without it, because when he was on it, he wasn't himself. He just felt really out of it when he was on it, but that was the only way he could leave his house. So he was talking to his psychologist, trying to get off of the medication and coming up with a plan, but it was a type that you couldn't just get off of, so it was something that was going to have to be tapered down. And he started receiving chiropractic care. And I remember the first time, a very specific technique of chiropractic that he was receiving, the first time that he got off the table after receiving adjustment, he said he could breathe more deeply and he felt more at ease and calm, which was huge for him because he hadn't felt anything like that for years without medication. But this was not with the medication. This was just from one chiropractic adjustment. So he started tapering down on the with the guidance of a medical doctor helping him to reduce the dosage. And over a period of time, he started to feel more calm and feel able to actually get out of his house without having panic attacks and have his mind much more at ease. Fast forward a few months, he was able to get off the medication completely, and he actually hasn't taken any of those medications or pills for his anxiety for a few years now, and he's able to go out of his house and able to function the way that he's supposed to. Our nervous systems are meant to be balanced, but there's so many things coming at us, so much trauma. We're sitting more than ever nowadays. If you've ever heard of the term or the book, Sitting is the New Smoking, we sit for 8-9 hours a day and then sleep for 8 hours a night. That's putting trauma on our body and on our spine and our nervous system and all of our body. There's more chemical things that our body has to process every single day. There's more emotional stress and even politics, and just 2020 being what 2020 is. There's so much stress from all angles that our nervous systems, it takes all that in, and it really can have an effect on our overall body. And so chiropractic is really there to not treat anything, not diagnose anything, but to really just free up that nervous system, allow our nervous system to be balanced and to work at its full potential so that you can be at your full potential. Now let's take a look at some of the research. There's so much research now on chiropractic and several different techniques, and there was a study done on 40 participants between the ages of 20 and 55, and they found that chiropractic adjustments, specifically in the neck, help to bring the nervous system into that rest and digest healing place of the nervous system and out of the stressed state. There's also other studies that have been done that show that chiropractic has decreased heart rate and increased heart rate variability, which, as I mentioned, that is the gold standard for your vagus nerve and measuring where your nervous system is in either a stress state or a rest state. There was another study done by Alternative Therapies in Health and Medicine. It was done in 2011, and they found that there was actually brain activity changes in people after they had their adjustments. In fact, in 2016, the Australian Spinal Research Foundation did another study, found that there was a 20% increase in the prefrontal cortex of the brain. So there's a 20% increase in activity. And the prefrontal cortex of the brain is that part of the brain that has higher thinking and is able to process and adapt. And that really is an amazing study that was done to show that it has effects on the overall nervous system, even changes in the brain. There's other studies, and if you want to take a look at these, I can send you the references. There's other studies that have been done, case studies on people with reduction in anxiety and depression and fatigue, and reducing these symptoms just by applying a chiropractic adjustment. Postpartum depression, that's huge for moms. If you've ever heard of the fourth trimester, that part that nobody talks about when you have kids, and that time where you're adjusting, a lot of women go through postpartum depression. Well, they did a study on 117 moms, and they were going through postpartum depression, and they did a questionnaire, and they then adjusted these moms for a period of time and compared what they felt like after the adjustments and before the adjustment. And there was a statistically significant difference in postpartum depression in these moms. Now, I told you there was a huge study done on quality of life in chiropractic care. And so we're going to go over that one now because this one is amazing. This study was done with over 2,500 patients in over 200 different network offices, network being the type of chiropractic care that they were receiving. And they looked at people that were in care between 1 and 3 months to people that were in care even over 3 years. And they looked at quality of life differences, and the findings were amazing. They found, and I quote, "Benefits of chiropractic care improved physical and mental health were evident from as early as 1 month and showed continuing clinical improvements over 3 years, with no indication of a maximum clinical benefit." This means that they found that there were no ceiling to the benefits that a person could receive from chiropractic care. I highly recommend you taking a look at the first episode of this series because it really talks about mindset of health. But when you think about health, it's so important to not put a ceiling on it, but you want to have healing that continuously goes up and up and up. And this is what that study is saying that happened. Now let's take a look at the stats. They found that the physical state of these people that they looked at had a 15% increase. That doesn't mean that 15% of the people had a change in physical state. That means overall, the 2,800 participants of this study had an overall 15% increase in their physical state. There was a 17% increase in mental emotional state, a 20% difference in their stress evaluation, and a 17% increase in life enjoyment. But when your nervous system is working the way it's supposed to, you receive the benefits and you'll continue to receive the benefits. And I highly encourage you to really do some research. If any of these studies I mentioned you want the link to, let me know. I'd be happy to send you that research. And it is such an amazing form of hands-on conservative care that is great for everybody, every age, and just finding the right chiropractor for you. And if you need help finding a chiropractor, let me know, and I might know someone in your area. I know a lot of great chiropractors, and I can help recommend you if you need somebody. And that brings us to our challenge of the week. The challenge of the week is to at least get your spine checked. You don't have to get adjusted, but find somebody that can check your spine, a trained professional, a chiropractor who can check your spine. You don't need to get adjusted, but just at least get checked to see how your spine is doing, the state of your spine, and if you have any misalignments that might need to be adjusted. Again, if you need recommendations to someone in your area, reach out to me. I might be able to recommend some people for you. And leave any questions that you would like in the comments. I'd be happy to answer them for you. Don't forget to smash that like button, hit that subscribe button, leave me a comment, a review. I so appreciate it, and this helps to get the word out to other people. If you know anybody that would benefit from this, feel free to share it with them. Check out my other episodes all about different things. Just did an episode on gut health. Every week we have a new topic talking all about how you can enhance your health. Don't forget to check out my website. It has a lot of great resources for you, drmichellegreen.com, where you can find resources, and there's a new meditation challenge out now. It's free 21-day meditation challenge for you as a resource. Check it out. And be sure to connect with me on social media, Twitter, Facebook, Instagram, at Dr. Michelle Green. I'd be happy to connect with you. Let me know what topics you want to hear about. I'm curious to know what you want to hear about, and we can make an episode about it. Thanks for tuning in. Happy National Chiropractic Month. It's time to enhance your health.